Hi, I'm Dr. Neha Dholakya, and I'd like to talk about a very commonly asked topic, what is PreLEX, especially in 2023. So what is PreLEX? PreLEX is presbyopic lens exchange. Presbyopia means when after 40-42 you get reading glasses, that's called presbyopia. Along with the femtolaser and the newer generation intraocular lenses, we can get rid of your reading glasses. Life after 40. After 40, the natural lens inside your eye stiffens and hardens and loses its ability to accommodate or change shape. Hence, we need reading glasses. A person may need glasses only for reading or only for distance or distance and reading both, and sometimes for computer too. As time passes, the reading number keeps increasing as the natural lens hardens and gets stiffer with time. One has to invest in costly progressive glasses, and finally the lens develops a haziness which is known as a cataract, and that warrants surgery for a clearer vision. In a cataract surgery, the opaque lens is removed and a new progressive artificial lens is implanted, whereby the distance, intermediate and near vision is regained back 85 to 90% of the time. If this is done before the cataract develops, just where the lens is inflexible or aged or old, we call it PreLEX, and this can eliminate the need to wear reading glasses. What about LASIK as an option? Yes, one can undergo LASIK as a surgery which is reshaping of the cornea. The advantage, it is far less invasive. The disadvantage is it will give you micro monovision, one eye for distance, one eye for intermediate, and you may still need to wear reading glasses, and one will have to undergo a cataract surgery at some future date. When to do PreLEX? Now, if a patient is happy wearing his or her reading glasses, distance glasses, bifocals or progressive glasses, that's perfect. Do not get operated. However, if one wishes to be rid of their glasses, there is a more permanent solution for this problem, which is called PreLEX. The best outcome in a PreLEX surgery will come if it is done with a femtolaser and if one of the newer generation IOLs are used. With the advent of femtolaser, the precision is just excellent, the safety is very high, and the cylindrical numbers can be reduced to as close to zero as possible. Moderate to small cylinders can definitely be eliminated. The newer implants in 2023. 2023 has given us the absolute best in lens implant technology, where the IOL can be selected as per the patient's needs. One can actually customize the IOL for the requirement of the patient. The artificial implant is selected based on the following factors: the daily use of mobile by the patient, the daily use of laptop, desktop by the patient, television usage, how much does he drive or she drive at night, what is the pupillary size in dimly lit condition, that is known as the mesopic pupil, which we calculate in our clinic, what was the previous specs number of the patient, what he or she is used to, is there a presence or absence of cylindrical power. Once we have all the above information, we can select the IOL that is best for the patient. So what is the process? 4 steps. First, measurements of your eye are taken on 3 different machines. The surgery planning is performed on the Varion or the Argos planning station so as to minimize the cylindrical power and the spherical power as close to zero as possible. Then the data is transferred to the femtolaser, where the incisions are made, which are bladeless and completely painless. Then the aged lens is removed in the operation theatre and a new progressive lens is then implanted with accuracy. So what are the drawbacks? It is a surgery after all. Second, the downtime after the procedure is 3 weeks. It's not like a LASIK where you do it today and tomorrow or day after you're partying. Third, the gap between the first and the second eye is approximately a week. That's what's preferred. It reduces your dependency on glasses by 85 to 90%, but not 100%. However, 8 out of 10 patients are happy without glasses. It takes approximately 1 to 3 months to get adapted to the new pair of intraocular lenses. Here is a short video. What happens after the age of 40 is that our natural crystalline lens inside our eyes becomes inflexible. It was able to focus like a camera before the age of 40, where one could naturally see distance, intermediate and near. However, now to focus something that is nearby becomes difficult. These muscles would contract and make the lens thicker and thereby allow near rays of light to come to a point focus on the retina. This flexibility of the lens, as you saw there, goes down after the age of 40, more at 50, more at 60, more at 70. Initially, when we would change our focus from distance to near, the eye could automatically do this without any effort. However, after the age of 40, we need reading glasses so as to make near objects clear, because this accommodation, the flexibility of the lens, goes down as the lens becomes aged and harder. So after 44, it's as stiff as a gummy bear, and after 50, more like wax. And therefore, the ability to focus distance and near of the lens goes down as the lens becomes older. So then we need to buy reading glasses, and slowly at the age of 47, you can see this brownish discoloration that happens. At 60, it's more. 70, 80 and 90, it becomes a cataract. With newer technology now available, we can do a surgery called PreLEX, which is presbiopic lens exchange. Here the natural crystalline lens is removed and a new lens, just as we do in cataract, is implanted. However, the lens here is a lens that allows you to see distance, intermediate and near, all three clearly. With this newer technology, which is femto laser, the precision of the surgery is much better than what it was before. The power reduction, we can take it as close to zero as possible, and the newer advances in the lenses by 2023 are simply fantastic, where the technology allows us to see all the distances. So if you wish to get free of your progressive glasses, watch TV without glasses, also see the mobile without glasses, and also sit on your computer without any progressive glasses and not having to spend so much, you can undergo a PreLEX surgery with good safety and accuracy. Who are the best candidates for PreLEX? Anyone above the age of 45 who has a reading addiction, has experienced reading glasses. Especially somebody above 50 is a very good candidate. Above 45, I would say patients who are very high minus numbers or high plus numbers, who really dislike wearing glasses, who are highly motivated to be free of their glasses, who doesn't want to spend on expensive progressive glasses year on year and would like to save that money, who would like to enjoy wearing sunglasses but cannot due to their numbered specs, and somebody who would like to enjoy the freedom of not having to carry their glasses around wherever they go, especially when they go to restaurants or go shopping, etc. Who are the best candidates? Someone who's also involved in playing sports. I operated on a patient who wanted to play tennis, one on table tennis, and one who was a marathon runner. Somebody who likes swimming, yoga, drama, dancing, etc. People who have a number for both distance and near get a double benefit, as one can get rid of both the numbers. Someone who is intolerant to contact lenses. Someone who on dilated examination shows early cataract signs is the best candidate, as she would have to or he would have to undergo the surgery sooner or later anyway. And this would obviously eliminate the need to do a cataract in the future. What's the difference in 2023? First, this would not have been possible without the cutting-edge new technology of the newer generation intraocular lenses, which provide distance, intermediate and near vision without the side effects of halos, glare and loss of contrast that were there in the older generation lenses. Second, the planning station. This planning station suggests to us the best plan to reduce the number of the patient to as close to zero as possible. Mathematically, using algorithms involving the centroid calculation, posterior corneal curvature calculation, anterior chamber depth, lens thickness, and a software that puts this all together, the whole information together, to deliver the patient the best possible outcome. And third is the femto laser. The femto laser that makes bladeless, painless incisions, makes operating very safe, creates an opening in the anterior capsule which is perfectly symmetrical circular, and pre-chops the edge lens and guides the surgeon for accurate lens placement, especially in cylindrical or toric lenses, thereby improving the safety, accuracy, and reproducibility time and again, over and over, of the procedure. So something worth considering if you don't like wearing your glasses. Thank you for listening. Dr. Neha Dholakia here.
Mm-hmm.